you so much for being here tonight with us. We are so lucky to have someone that is very well known to EF&E. Emily Daggett is here tonight to talk about early intervention services and what they are, and if your child will qualify, and if they do, what is the process? How do you get them to qualify? What's the process of getting them referred for services? So she's going to go ahead and share with us all of that information tonight and kind of give us a little bit of education. So I am going to actually hand the torch to Emily, and she's actually going to do her own introduction and kind of give you a little bit about background about herself. Thanks, Emily, so much for being here tonight and volunteering your time with us.
Yes, thanks. Thanks for having me. And thank you everyone who's joining us tonight. As Christine said, this is going to kind of be like an early intervention 101. I'll go over the agenda. But to start with introductions, my name's Emily Daggett. As a mom, I have 3 kids, 2 girls and a boy. My oldest daughter was in early intervention because she was born prematurely. During a reassessment when she was 2, she was found not eligible for early intervention anymore as she caught up in all of her delays. My third child, my youngest daughter, was born with a rare genetic disorder, and she also has epilepsy. She started an early intervention as soon as she was discharged from the hospital. She was in early intervention until she was 3, and at that point, she transitioned to school. And she goes to an out-of-district placement school for kids with significant disabilities and medical complexities. I share this because you will see in terms of eligibility for early intervention, there's a very wide spectrum, and I've kind of been on both ends. Professionally, I do not actually work in early intervention. It's very confusing, but I run a specialty service program for early intervention. So in the state of Massachusetts, the Department of Public Health created a program called Regional Consultation Program. There's 6 of us in the state. We all have a catchment area. Our program is for kids enrolled in early intervention who have additional medical complexities or multiple disabilities. So I cover 11 EI agencies. And so any kids in those agencies that, again, have medical complexities or multiple disabilities are going to get referred to my program, and I'm going to work with that EI team. So again, I wanted to share professionally and personally, I have different experiences with early intervention. I'm going to jump into the agenda, but I just want you to know this is not meant to be overly formal. So please stop at any time with, questions or clarifications, or pop it in the chat. Okay, so tonight, like I said, it's a EI 101. So we're going to talk about early intervention. What are the services offered? What's the referral process? Who's eligible? What's an individualized family service plan? What happens at age 3? And then we'll have time for a question and answer. And then I just want to start with, I'm going to say early intervention during this entire presentation. That's what we call it in Massachusetts, and that's what we say in a lot of states, but not every state. So it's the same thing as in Connecticut. If you're in Connecticut, they call it birth to 3. So it's the same program, different names. All right, so what is early intervention? So early intervention is a program in every state in the country. It's free in every state in New England, and it is a program specifically designed for children ages birth to 3 who are experiencing a developmental delay or at risk. And so again, I just really want to say there's quite a spectrum of who might be eligible for early intervention. So it might be a 20-month-old who is meeting all milestones except not walking. That would be a really great referral to early intervention and possibly being eligible for physical therapy. And it could also be a child who's born with a known genetic disorder, a newborn day 1. They're clearly not experiencing a delay yet, but you know that they're at risk of a delay. So again, they're going to be eligible for EI. And then, it could be something like you're 14 months old and maybe not babbling yet. So there's a wide range of services offered and who is eligible. Okay, so what's the purpose? The purpose is really to close that gap. The purpose is to help the child and help the family meet those developmental milestones. In terms of closing that gap, that's really what happened with my first child. My daughter was eligible. She was a preemie. She was in the assessments. She was delayed in domains. We were in EI. We worked with her at home, and then at a reassessment at 2, the that gap was closed. She's not eligible anymore. That is really kind of the classic case of what the purpose is. But then also for my youngest daughter, who stayed in EI until she was 3 and then went to school for significant disabilities, EI was still critical in helping her work towards developmental milestones on her own timeline. Okay, so how? So how do we close these gaps? How do we work towards developmental milestones? And that's really getting the appropriate services. So I cover 11 EI agencies in the state of Massachusetts. They cover 60 cities and towns. Not one of my EI agencies is the same. I say that because sometimes it's a staffing issue and sometimes it's a structure issue. These are just some of the services that you're going to see. So, physical therapy, speech and language therapy, which I prefer to call communication therapy, occupational therapy, a developmental specialist, music therapy, nutritionist, a nurse, a social worker, a licensed mental health counselor. Sometimes there might even be things that I'm missing here. These are typically the EI professionals I'm working with. But again, I have an EI agency that right now doesn't have a speech language pathologist, but these are the types of services that are available. Specialty service programs. So in the state of Massachusetts, we have specialty service programs for kids who are enrolled in early intervention, so they're birth to 3, but they need services that aren't covered by what I just shared. So they need things in addition to PT and OT and an SLP. So a child with a visual impairment or a CVI, and they need vision services. A specialty service program in Massachusetts is Perkins. For deaf and hard of hearing services, we have a couple of options. One is Clark School, Applied Behavioral Analysis Services, ABA, and then my program, which is the Regional Consultation Program. However, we are changing our name as of 7/1. We are becoming the Medically Complex Care Consultation Program. So we are all working. We are in addition to their EI team. We're working with them birth to 3, and we're still following that format that we're working with them in home. So for example, if your child was eligible for vision services from Perkins, the TVI is coming into your home. Okay, so where? Okay, so where is, in terms of EI, it's supposed to be in a child's natural environment. That can be home, that can be daycare, that can be grandparents' house, that can be community, and you set up a session at the local park to do physical therapy. It's just, so it's really where does your child spend the most time, and that's where EI is. So I'm just going to keep reiterating. EI is for birth to 3, for kids either experiencing developmental delays or at risk for developmental delays. It's free, it's in home, and the direct service providers come to you to work with your child. What's the model? So the model in early intervention or birth to 3 is we follow the principle that the caregivers are the most important part of the team, and they are the child's greatest indicator of progress. So early intervention, especially if you only have a PT coming into the house once a week and your child's getting PT for 60 minutes a week, I don't know really, there might be limited progress. So the model is that the physical therapist or the speech language pathologist or the OT is working with the child and the family to figure out what strategies are going to work that the family can continue throughout the week, can continue can build into their daily routine and can be sustainable so that the child's not just working on a goal once per week, but it's really woven throughout the week. So the EI professional, their job is to develop those strategies and then model ways to utilize those strategies in home. Okay, so sample scenario. So again, this is just saying there is such a spectrum of what early intervention might look like. So you might have a child who's found eligible at 17 months because maybe they only have 5 single words in their vocabulary and they're only eligible for a speech language pathologist. You might have, again, a child maybe with a known or an unknown diagnosis so far, because we know sometimes it can take a really long time, the diagnostic odyssey. But maybe you have a child who's 9 months old and, hasn't smiled yet. Maybe they're experiencing a lot of feeding difficulties. Maybe they haven't rolled. So there's really all different kind of situations where a child could be eligible. And I just say, if you have any concerns, just get evaluated. The whole thing about early intervention is it's voluntary. So just asking for an evaluation doesn't mean you're locked into anything. So if anybody has any wonderings, get evaluated. So who refers? I have heard from a lot of families that they felt like their referral was delayed because they were waiting for a doctor sign off. But I just want everyone to know anyone can refer to EI. It doesn't have to be the pediatrician. It can be the parent doing a direct referral. It can be the case manager doing discharge from NICU. It can be the grandparent with the parental consent. It can be, foster parent, caregiver. Anyone can refer, and the referral process is pretty streamlined. I have here the links for every state in New England. At least I hope I caught them all. And so you go to the link. Basically, you're just going to navigate to where it says find the program. You put in your town, and then it tells you which one is your EI agency. All you have to do is call that agency and say that you want to refer. And then the EI agency takes that and starts moving it forward. So who's eligible? Okay, so I'm wondering, my 9-month-old, or I'll say my 13-month-old isn't sitting independently, but every other milestone seems to be okay. I have wonderings, so I self-referred. I referred to my EI agency. So what happens next? A coordinator from my local EI program is going to call me and explain to me the process. So over the phone, they're just going to get some basic information about my child, and then we're going to schedule an evaluation, and that evaluation will be used to determine eligibility. When the team comes to do the evaluation, and for an EI evaluation, there's always going to be more than one EI professional. They're going to be a couple across domains. They're going to use a standardized assessment. In the state of Massachusetts, we use the Patel. It's highly probable that that's what's used in other states, but it might be something slightly different. It's a standardized assessment that's going to look at the child in all of these domains. So they're going to assess your child on cognitive development, physical development, which includes gross motor and fine motor, communication development, which is receptive and expressive language, social emotional development, and adaptive development. And especially in the younger kids, the biggest thing with the adaptive development is really looking at feeding. And that's for, very young. Okay, so I submitted the referral. The EI coordinator called me, explained to me the process. We scheduled an evaluation. They come to my house. They do this assessment. And then, depending on the assessment, if my child is found to have a delay in any of those domains, then they're found eligible for early intervention. So again, it might be just eligible in the physical development or just eligible in adaptive development because my child's experiencing feeding difficulties, or just eligible in communication because maybe the expressive language is a little lagging. But any of those domains that has a delay, your child's eligible for EI. So what happens next? Um, because you're a very important part of the team, the caregiver, the EI team, create an individualized family service plan. So if you have kids in the school system, they have individualized education plans, IEPs. An IFSP is different, but the idea is similar in the sense that it's a written legal document. It's going to describe the supports and services that your child is eligible for and will receive. It includes specific goals, and it includes timelines for review. What's very different with an IFSP versus an IEP is the goals are truly driven by the family. So your EI professionals are going to help you figure out and prioritize the goals. But because it's so family centric, the goals are really driven by family needs and family priorities. I said in terms, so an IFSP is reviewed and there are reassessments. This does change across towns and states. So I have some EI agencies that will do an IFSP review every 6 months, and I have some that do it annually with the reassessment. So with that, you're found eligible for early intervention. You've got your IFSP, you've got your goals. You're going to be reassessed annually. So say you get in at 1, you're going to be reassessed when your child is 2, and then they're going to use that standardized assessment again to say, is that child still experiencing any delays? If yes, you continue to be eligible for early intervention and they write a new IFSP. If no, then that's great. You've closed that gap and your child's not eligible for early intervention anymore. I will say, in addition to that, there are some diagnoses that at birth do have a child continue to be eligible until 3. Again, those differ from state to state, but it's a very small list of specific genetic disorders. Does anyone have any questions for me so far, or am I going too fast? I can't see the chat while I'm in presentation mode, so let me know if there's anything in there.
Emily, you're doing great. There is nothing in the chat at the moment.
Okay. All right. So what happens? So if your child continues to be eligible for early intervention, then early intervention goes until the day before their 3rd birthday. So what happens at the magical age of 3? So 2 things happen. Either your child is continuing to experiencing delays and is going to be eligible for special education, or your child is found not eligible for special education. So your early intervention team, either way, is going to help you navigate this. It's their job to do this transition. So in the state of Massachusetts, when a child is 2.7, we get parental consent, and then we send their information to their local school district. The local school district, and then there's this whole process that we can go into. The local school district has a meeting with the family and EI. There's consent forms signed. They evaluate the child, and then they hold a team meeting. At that team meeting, it's the eligibility determination. So the team decides, is this child eligible for special education at age 3? And if it's yes, they're going to transition into their local public school. Now, they can transition into their local public school, or if their local public school is not the appropriate placement, there are also out of district placements, and that's where my daughter went. So at 3, our local public school could not provide my daughter the appropriate services. So again, she's out of school, out of district, that specializes in significant disabilities and medical complexities. The other thing that happens is with parental consent, EI sends the file off to the local school district. Again, they have a meeting, they could get consent forms, they do a full evaluation, you come to the team meeting, and the child's found not eligible for special education. They're just not exhibiting delays in domains. And so what happens is either EI is helping you transition to school and they're there to get you into school, or EI is there to the third birthday and then they say, you're not eligible anymore, and either your child is staying at home until they start kindergarten, or they're going to a daycare or a private pay preschool pre-K, but they're out of the early intervention model. Okay, so key points. EI programs are in every state. In New England, they are at no cost to the family. It's typically funded by health insurance and then offset by the Department of Public Health. EI is for birth to 3. It is designed to support a child's development, whether that's closing the gap like my oldest daughter, or when it's helping them continue to develop along their own timeline like my youngest daughter. It takes place in the natural environment, which is just where does that child spend most of their time? Maybe they spend most of their time at their aunt's house and she babysits, then they're going to have EI at the aunt's house. Again, no cost. Anyone can refer. You do not have to wait for the pediatrician. If I have experiences where and I'm sure we've all felt this way, where maybe medical providers didn't listen to us, where families go in and they say, at 8 months old, I was starting to worry, but my pediatrician said, well, let's just watch and wait. And we don't recommend the wait and watch model. Why not just get evaluated? Again, it's voluntary. You're not locked into anything, but let's just do some standardized assessments and see where your child is. And with that, again, it's voluntary, but early intervention is strongly backed by research. I mean, I could have put so much in here. There's so much research on early intervention. I just grabbed a couple of things off of the CDC, but there is just tons. Hospital facilities, universities. I mean, just everyone has done research on early intervention, and it's all comes out earlier is better. It's a bridge. It changes a child's developmental path. It helps families understand strategies. It's that front loading. Why not front load from birth to 3 when the neurons are building instead of waiting to 5? It's so individualized. So my experience, you tend to develop such a relationship with your EI team, especially if they're in your home every week. It's like another family member, but it's a family member who's coming in, who specializes in whatever domain they're working on, whatever discipline they're working on. And then you're learning from them and being able to incorporate those strategies. So I will just say earlier is better. That's why we say don't even wait and ask for an evaluation if you have any wonderings. And it just really helps children work on their developmental timeline. I feel like I blew through that. So we can stop here, and I would really love, especially if I went too fast or if there's clarification questions, but this is like the Q&A part, or if there's something you want me to dive more into. I do work in my role as the RCP coordinator. I work very closely with EI in the transition to school. So I work really closely with the families of children who are eligible for special education at 3. So if anyone had really specific timeline questions, we can go over that. But I'm going to open the floor.
There are no questions in the chat, but I will start with a question. So my son had EI, and one of the things I never quite understood was occupational therapy. Do you think you can describe what that is specifically?
Yep. Okay, yes. And I think of it in 2 things. So one, I'm not an OT. So if an OT hears this definition, I might get schooled. But as someone who works with OTs and someone who's had OTs in my house, so I just had a question, like, what's the difference between PT and OT? And so for me, OT is well, first off, it's fine motor skills instead of gross motor skills, right? So gross motor skills are your large muscles, and the PT is working on things like sitting independently, rolling, kneel to stand, taking steps, right? That's all the physical therapist. I think of the fine motor of being those smaller muscles. Again, I don't know if an OT would agree with me, but there's different things they can work on. So an OT might be working on, especially for kids in early intervention, maybe a pincer grasp. Maybe you've got a 14-month-old who's not able to self-feed because they aren't able to pick up the finger foods. So that's going to be your fine motor task. So your OT is going to come and help with that. In early intervention, an OT, so in early intervention, in terms of working on feeding, you can be an OT with a feeding background or an SLP with a feeding background. So both OTs and SLPs can do it, but it depends on if that's their background. So in my situation, my youngest, who is fully dependent on a G tube, we did do feeding therapy with her, oral motor therapy with her. Our OT did that. So our occupational therapist worked on oral motor and worked on feeding. So those are, again, OT, I'm sure would give you a much better one. Oh, and then I sometimes forget this because this isn't something that we dealt with on a day-to-day basis, but a huge thing in like lifespan is OTs also specialize in all of those sensory issues. So it's like the fine motor, the sensory, the feeding. And they work on, and they always make fun of all of the senses, right? There's way more senses than what we grew up with. And so, for instance, my daughter had gravitational insecurity, my youngest. So she's the only one of my three who could not be baby worn, right? And so that's, I'm going to say perioceptive sense, perioceptive. I might be saying it wrong. ROT worked a lot with her on her perioception. I'm definitely saying that wrong. But those are just some of the things that the occupational therapist does.
What is perioception?
Awareness, again, I'm not a PT. I knew I was saying it wrong. Awareness of like where your body is in space.
Proprioception. Thank you,
Prop,
Jordan.
proprioception. I still might not be saying right. But my understanding is understanding where your body is in space.
Okay.
Mhm.
Do you want to, if there aren't any questions, I'm thinking maybe you can just break down what each one is, like the SLP, speech language
Oh, sure.
pathologist,
Absolutely.
just what
Yeah.
each of them maybe targets for people that don't know.
Thank you, Jordan. Okay, yes, absolutely. So, a speech language pathologist works on communication therapy. And again, when I talk about EI in general, right, in school and life, there's such a spectrum. So, the speech language pathologist works on anything with communication, receptive and expressive. It might be a child is receiving EI services, well, we're not doing articulation and EI, which now speech sound disorders, but maybe it's they just don't have the amount of, maybe they're two and they're not putting two words together, right? And so the speech language pathologist is working on language, building vocabulary. Maybe they have language, but there's a receptive issue, and they're working on them, trying to, work on multi-step tasks that are age appropriate. It might be like my youngest that there's not going to be expressive oral language, and the SLP and EI is introducing AAC, augmentative alternative communication systems. And I say systems because it's, again, there's a spectrum. Sometimes people hear AAC and they only think a speech generating device, but it's systems. So it might be using a picture, like a static picture symbol system. It might be introducing a voice output button and then building towards a speech generating device. So So the SLP is communication therapy, the OT is occupational therapy, a physical therapist is working again on the gross motor. So just how, again, kind of those big developmental milestones for birth to 3. So rolling, sitting independently, push to stand, bearing weight independently, starting to take steps. And then with an early intervention, right, there also can be tons of equipment use. My daughter is a wheelchair user. In early intervention, we trialed lots of, so my youngest is a wheelchair user, but as we know, for most, it's multimodality, right? So she's not always in a wheelchair. She also, therapeutically uses a gait trainer. So our physical therapist started her on a gait trainer when she was like 15 months old because she was ready. So that's the PT, SLP, OT. A developmental specialist, a lot of times a developmental specialist is someone with a teaching license. So I am from the Department of Public Health. So I probably didn't, so my background, I was a special education teacher in Boston Public Schools for 10 years. And then my third was born with a rare genetic disorder. I had to leave my career. I stayed home providing all of her care for 3 years. Then she transitioned to that full-time specialized school. And then I started in this role. I'm not an EI professional. Like I said, it's so hard to explain, but I run a specialty service program for EI. However, I do have a cert by the Department of Public Health that I'm also a developmental specialist, and I have that because I have a teaching license. So a lot of the times when they're really young, a DS might be the first one to come in because a lot of times PTs, SLPs don't start until like the child's, well, an SLP might not start till the child's about 1. PT might be between like 6 and 12 months. So usually early on is maybe an occupational therapist um, and a DS. So your DS is kind of like we go in with the holistic view. So we're really monitoring all of those 6 domains.
Wait, what's
So,
DS?
oh, sorry, the developmental
Yeah,
specialists.
I don't know all these letters that you keep
I
throwing out.
know.
So yeah, if you don't mind saying them, actually.
No,
Okay,
I'm
thank
sorry.
you.
I'm sorry.
Okay.
Yes.
Developmental specialist.
So the
Okay.
developmental
All right, thank
specialists,
you.
yeah. So they might be the first one, especially if your child gets into EI really young. The developmental specialist might be the first one assigned to your child, and they're also doing the monitoring. So that say it's 6 months later, and they're like, oh, I'm noticing there might be a little bit of a delay in another domain that we didn't know of 6 months ago. Then that DS is like, okay, let's bring in one of our PTs to do a consult. And then if the PT says, oh, yes, we agree there's a delay there, then the PT gets added to the team. Physical therapist. Okay. Music therapy. I love music therapy. I wish every EI had one. I actually have some EI agencies where a family will get a music therapist first, younger, over an SLP, because all of the research about music building language. I love music therapy. I don't have a ton of EI agencies that have a nurse, but I love when they do. And it's just kind of what I see is they act as the service coordinator. So they're just kind of keeping track of everything that's going on. And then all of my agencies have either a licensed social worker or a licensed mental health counselor. They also tend to be either service coordinators, or they also are there available for the parent support. So in my agencies, parents can get therapy from either the social worker or the licensed mental health counselor. I have one that has a nutritionist, and I love that. She works with the kids getting discharged from the NICU with feeding tubes, or the kids with, a failure to thrive diagnosis.
I love that they have therapy for the parents
Yes.
because when we started the early intervention, I had to resign from my full-time teaching job, and now I'm all of a sudden a stay-at-home mom with no one to talk to. So I felt like they all became my therapists as well. They
Oh,
didn't have a direct therapist, but just talking to all the EI specialists that came into our home was
Amy, I didn't know we had the same background. We're samesies.
It was critical to me, like to get through the beginning of our journey, having them. And I'm still friends with a lot of the people that were in our home. I also wanted to add we were lucky that the office where all of our EI came from was right up the street from us, and they did a weekly play group, and that was huge too, because that was the first time I was able to bring my son into an environment where he could play with other children and, learn in that setting. So that was great for us as well.
Yes, thank you for mentioning that. Many EI early interventions do have center-based program. So we have, for most of mine, a baby group, like a baby play group. The caregiver has to stay, and a toddler play group. And they're usually like 1.5 to 2 hours. And they're at the center, and you go once a week. And I agree with Amy, they're fun. You get to meet other families. It's really the child's, especially if they're at home, first time, like out in the community, working on those socialization skills. I also wanted to say, just some points. And sometimes, there might be, so with Amy, I am still in touch with both of my girls' EI team. It also helps that I cover that agency now. But I do hear from families that it might be you might have gotten assigned someone that you just don't mix with. And so I want parents to know their rights at any time. You can say, I don't want this specific person in my house. Is there another speech language pathologist available? Every state also has a position. So in the Department of Public Health, we have a position. I can't think of what her actual title is right now, but it's who you file all your EI complaints to. So unfortunately, what's been happening the last couple of years is there might be a child receiving early intervention who's absolutely eligible for communication therapy, but the agency does not have an SLP. And I will tell you, it's not because they're not trying to hire. It's low pay. And it can be really hard to find the staff. There's just been a lot of staffing issues. And I'm not saying that that's okay. And that's why every state has a person who will receive those, official EI complaints or inquiries. And let me, squeaky wheel, they will work with the families to try and find something.
I know in Maine, ours is a little different. So ours is called CDS, CDS, which is Child Developmental Services. So my daughter, just like your daughter, your child, Amy's, we all have the same story. So we did the same thing. So I know, Emily, you talked about how, like, not to wait. So we had that happen to us. So Delia was 18 months, my older daughter, Morgan. Same thing with me, teaching, left the position to take care of Delia. And I had my older daughter. So I knew right off the bat that, like, she's 18 months old. She was just sporadically saying words here and there and not talking very much. And my other daughter, Morgan, at a year old, was saying a lot more words. So I was concerned. Went to our pediatrician, said, I'm really concerned about this. Like, I have some concerns, some other concerns with her. And she says, oh, just, every child is different. They all develop at different times and stages. Just wait it out a little bit more. When she turns 2, we can have a conversation again if she has an increase. She was at 18 months. We're only talking a few more months. So I went home and I thought about it and I was like, yeah, this isn't right. So I looked at the fact that parents can make the referral. So I referred my daughter to CDS. They came, they did the referral, the whole piece. Delia had epilepsy at the time, so she was already diagnosed, and she actually qualified for speech, OT, and PT. So we started with early intervention services in our house. They came to our home, did our stuff like everybody else. But then at the age of 2, she was placed, and we were asked if she could be in a early intervention school. So the preschool that she went to was the Morrison Center in Maine, and she was actually placed there for a good part of the day. Her case manager too, which was great, stayed with her until she went to kindergarten. So her IFSP then turned into her IEP. And a lot of the times it is so much easier when your child is identified before going to school, because your care plan for them is already created. And then what happens is that the public school will send their special ed director to the school program that they saw my daughter in, and they observed her. And they said, you know what? This school can provide right now way more services than our school can. Like, our public school cannot um, give her as much. And this was in a different town. This is in Scarborough, and we were in school in soccer. So they actually allowed her to stay an extra 2 years at the Morrison Center and do her kindergarten there. And because of the fact that we already had this set up through CDS and IFSP, it made things easier for her. So she was able to stay in the specialized school, because the school had their speech therapist teacher there, their PT speech therapist there, OT. And then they also ran a preschool kindergarten with typical neurotypical kids. So she got to take place inside of a neurotypical classroom and be alongside general ed, but still have the safety net of the developmental preschool around her. So it was we were very lucky, and we know that other kids in Maine can do that too. So I just want to bring that up because I know every state's a little different.
Yeah, we don't have EI center-based schooling.
We have a lot of that here in Maine.
That's
So
great.
CDS will
I'm gonna have to
pay.
look that up.
Yeah, CDS will actually pay for kids to be placed in these preschool, like these developmental preschools. So we have ones for specifically for autism. So kids that are on the spectrum and have more of a severe case, they can be placed in these schools. It's great because it gives sometimes parents that break too. I know for me, that's when I started working for the foundation, and it allowed me to have that time to actually do my job when she was there. And they took great care of her, and she got to socialize, and it's intense therapy. And they have like a music therapist. They have, everything that you could possibly need. They have a full-time nurse. So never had to worry about her seizures or anything like that. So definitely, ask those questions. Specifically, if you're state by state, it's a little bit different with what they do in the services. But definitely don't, I guess my question is like, look at, what's available in your state and ask those questions, because I know it can make a huge difference. And I truly believe that the reason Delia can talk today is because of them. Because Emily, they did exactly what you talked about. We got the speech therapist that was there was awesome. And they got her an augmentation device in the beginning, and that helped her. And then they did snowshoeing with her in this winter for PT. So their playground was amazing, because it was the ground itself was this like spongy material, so that if she fell having a seizure, she wouldn't be injured. So it was a specific playground that was made for kids with disabilities. So people in wheelchairs can get on it. It had, all tactile kind of things for sensory. They're the ones that taught me the brushing program when she was having major sensory integration issues. They had everything there at their disposal for her. So again, look at your states and see what's available, because we were very, very lucky that she had those services in Maine.
I'm gonna look that up. We need that in Massachusetts.
Yes. Yeah, we were very lucky. And she was one of the youngest that went into the program. And she was on the ketogenic diet at the time, and they had no problem, with helping with any of it. We were very lucky on those early stages, and she had her own one-to-one in the classroom. So it was great. And she was alongside other kids. We had switched to public school finally because her class was more severely affected children that were nonverbal. And she kind of aged out of that group. So it was time we felt like it was time that she could be then in a mainstream classroom at that point, and felt like that was a good choice. But she was able to get that intense. She had missed a year because of the cancer, so they were able to make it up. And they would first Zooming, I think, classroom she's ever had, even before Zoom was a thing. They would FaceTime with an iPad with her in the hospital. so she could still take part in a lot of her activities there. So, which was really, really cool. So yes, definitely, check in to see what's available in each of your states.
Yes. Yep. And on those slides I sent, those will link right to your state's website with the early intervention or birth to 3 or CDS program information. Any other questions for me or anything to share? Anything I can clarify?
I'll quickly add to, they were very helpful in helping us outside of the time they were there. So like they told us about like, the cushions and the weighted vests and like we've tried so many things that they were able to let us borrow and kind of try out to see if it worked for him. So it was great. It was a great experience. And just like Christine, like the plan that they had for him, transferred over into his IEP. So it was a very good experience.
In terms of loaning, many EIs do have some sort of assistive tech loan program. In Massachusetts, the RCP manages it, so I manage it for the Metro West region. But we do have some things to loan in terms of AAC systems, so switches, switch activated toys, voice output buttons, iPads with speech generating apps, and then also equipment in terms of, specialized seating systems, needing a tumble form, um, gait trainers, walkers, standers, adaptive strollers. So it's going to look different about who's got what available. I have a very big loan program, but most centers have something available for loan. And again, you would have access to it until your child's 3rd birthday, as long as they're still using it. What is best with the loan program is just trialing the items and then going through an equipment clinic and getting the equipment, customized for you. But we all know that health insurance process can take a long time. Is everybody in EI here or receiving services?
We have quite a few of our community healthcare workers on here today. And
Okay.
I want to say thank you to all of them because I know they're going to bring all this information back to their clients who will benefit from this. So, and then we have a client, 2 clients, 3 clients, a mom that we've done a lot of training for her daughter. And I believe, correct me if I'm wrong, Cheryl maybe is a nurse, but I could be wrong about that. I don't know. But yes, Christine and I went through it.
And
Thank
their
you.
services are free, right, Emily? Are their services free?
Early intervention?
Yeah.
Yes. Yes. Yes, yes, yes.
Do you
Typically
get
covered by
reimbursed for
health
the travel?
insurance and your state's Department of Public Health. What was that?
I was gonna ask, do you get reimbursed at all for your mileage to take your child back and forth to OT, PT, speech?
Um, does the parent get reimbursed for mileage?
No.
No.
Do in Maine. So
Oh,
parents
really?
get reimbursed. Yeah. So every time I would drive my daughter to school for the early intervention services, I could get reimbursed for her mileage. They could also provide someone to pick her up and bring her to school for me. So that
Okay.
way I wouldn't have to do that. So what I would do is to the early intervention schools that
Yes.
they have, then I would get reimbursed for the mileage of that.
So we do have programs for mileage reimbursement to medical appointments. Reimbursement for rides to therapy appointments are a little bit more specific about it. It's like getting really nuanced. Like there are some, so Department of Children and Families, right? If you're involved with DCF, you can get reimbursed for those, but that's not just any family. However, we do provide free transportation. So if the family doesn't have a car and chooses not to drive, there is transportation to the center. There is a van process, and that's at no cost.
Thank you, Emily. I want to thank you for
Yeah.
elaborate on? I knew there was something, so I wanted to make sure
Yes,
we
yes,
covered
the
it. Thank you.
van, yep, you can do the van. But the like if I was going back and forth to the center, I'm not going to get reimbursed.
Are there any other questions for everybody that's here?
If not, you can share my contact information and I'm happy to answer any questions at any point.
Thank you. I appreciate you so much.
Thank you.
Nice to also hear from somebody who's gone through it and lived it and is able to talk about it and then provide the services. So we're very, very appreciative of that.
Well, thank you for having me. And I will always say thank you, EF&E. You do a lot for my RCP families. So
We're
thank you.
happy.
Thank you.
Helping. Yeah, we're happy to keep helping. That is for sure. Thank you again, everybody. Thank you, Emily, for volunteering your time tonight with us, away from your family. I know it's not easy at night. But I want to thank everybody for being here tonight. This recording will be available. If you haven't had a chance yet to take a peek at our YouTube channel, all of our past webinars are actually on our YouTube channel.
Oh,
So please take a second to go and look at our EF&E YouTube channel, and you'll see lots of very great, I can say very great webinars from past years as well. So if there's something you might want to learn more about or missed, you can find it there. So thanks everybody for being here tonight.
Thank you,
And
Emily.
look forward to
Thank you.
having you
Thank you.
guys again.
All right. Have a great night.
Thanks so much.
Good night.
Thank you guys, everybody.
Thanks.
Bye, Emily.
Bye.